Okay, gracias, Erwin.
Okay, well, we're getting ready to start. Thank you, everyone, for your patience. Good morning from Washington, D.C. Thank you so much for joining us this morning, afternoon, or evening, depending on where you're connecting from. Welcome to the webinar, Assessing the Performance of Social Protection Systems, Experiences Using the Core Diagnostic Instrument in Lebanon, the Philippines, and Guatemala. Before I get started introducing our presenters, I would like to thank socialprotection.org for hosting this webinar. Now, if we could go to the next slide. First and foremost, big thanks to all of our speakers who are joining us today from different cities and time zones. Let me welcome our panelists and introduce them in no particular order. Joining us today are Francesca Bastagli, who will be sharing her experience with CODI in Lebanon, Jorge Avalos, who will talk about his experience in the Philippines, Veronika Wodsak, who will tell us a bit about CODI, and Ana Cintrón, who will share her experience on the recent application of CODI in Guatemala. Let's move to the next slide to tell you a bit more about our speakers. Francesca is the head of social protection and social policy at ODI, specializing on design and monitoring and evaluation of social and social protection policies. Her recent research examines social protection and gender inequalities in the world of work, fiscal policy, income and wealth inequality, social protection effectiveness in the context of displacement, and the alignment between social protection and humanitarian assistance systems. She has led and co-authored many important publications, including one I personally reference often, Cash Transfers, What Does the Evidence Say? Welcome, Francesca, and thank you so much for joining us. Next is Jorge Avalos. He's a social protection consultant at the World Bank, focusing on the design, delivery, and evaluation of programs. He has been with the Social Protection and Jobs Global Practice since 2012, providing technical assistance to programs in several countries, and also conducting rigorous impact evaluations. His recent work focuses on how programs can improve nutrition, the design of shock-responsive social protection programs, and the measurement of social protection systems performance. He's joining us back in DC after 6 years of being based in the Philippines. Hola, Jorge. Thank you for participating today. Next, we have Veronika Wodsak, who is joining us from Geneva. Veronika is a social protection policy specialist at the ILO, where she has been working since 2007 in various roles, including health policy officer, social protection floor officer, and social security expert. She is one of the co-leads of the ISPA coordination team that is managed jointly by the ILO and the World Bank. At ISPA, she has been involved in all of the working groups to develop ISPA tools and is responsible for the social protection policy option tools, also known as SPOT. Hi, Veronica. Thank you for joining us. We are also joined by Ana Cintrón, who is connecting from Guatemala. Ana is an independent consultant, specialist in the design and evaluation of social projects and business plans in the small and micro-productive sector in rural areas, which includes crafting support plans for entrepreneurial women groups to integrate them into the global value chains. Her past experience includes urban time at the urban planning unit at the Guatemala City Municipal Government and consultancy at the UNDP, where she designed and implemented social programs and contributed to the establishment of a broad social safety net in Guatemala, among others. Thank you, Ana, so much for joining us so early in the morning, and welcome. Last but not least, let me introduce myself. To make matters more complicated, my name is also Ana Veronica, and I'll be your moderator today. I'm a consultant at the World Bank, where I have been at the Social Protection and Jobs Global Practice since 2012. I'm currently working on 2 of ISPA's forthcoming tools on social assistance cash transfers and social information systems. Next slide, please. Before we get started, I just have a few other PSAs. Just a reminder that this webinar is being recorded and it will be available online. Also, all questions are welcome throughout the webinar. Please use the chat on the bottom right of your screen, or via Twitter using the hashtag SBOrgWebinar. We will address all questions at the end of the discussion. Another reminder is that you can find CODI and all of its components on our website, ispatools.org. I will attempt to do my very best at keeping time to ensure that we have enough time to cover all questions of the audience at the end. Without further ado, let's get started. This webinar will have two sections. First, we'll hear about the tool, the core diagnostic instrument from Veronica. And in the second portion, we'll divide into the process of the CODI application, where our panelists will tell us about their unique experiences in Lebanon, the Philippines, and Guatemala. Veronica, over to you.
Thanks very much for the nice introduction, Veronica. I'll try to be really quick. I just want to give a quick introduction to CODI for those of you who may not be so familiar with the tool yet. But obviously, with the great speakers that we have today, we would like to spend as much time as possible hearing from them and how the tool has been applied in practice in the countries. So if we go to the next slide, please. So what is the tool? We can immediately go to the next one. CODI is one of a whole suite of tools that we are currently developing jointly, and jointly means a coalition of over 20 agencies that is involved, creating consensus on these really systematic analytical frameworks for looking at various aspects of social protection. CODI, the tool that we are discussing today, is a system tool. It really tries to look and analyze the social protection system as a whole. So I will go into more depth later, but we also have tools that look more at program level. So we already have published a tool on social protection public works programs, and we currently are developing a tool on cash transfers programs. And in the future, we hope to develop a tool also on social health protection, potentially one on aging. And currently, almost ready to be published, we also have a tool to analyze food security and nutrition programs. And then at an even more detailed level of analysis, we have tools that really look at a very specific aspect of delivering social protection programs. So we have a tool that looks at identification systems for social protection programs, and one that allows to analyze payment mechanisms for social protection programs. And in the future, again, we are currently developing a tool on social information systems, and we hope to develop further tools, for example, on case management, on complaint and appeal mechanisms, on data and monitoring and evaluation, etc. So in the end, the ISPA tool suite should really provide tools to analyze any specific aspect that you may want to look at when working on social protection programs, no matter which policy area or risk or branch they relate to, and no matter whether it's at the central level or on a specific program or on the delivery of the program. Next slide, please. So in terms of CODI, the core objectives of CODI are really, as I said, if you analyze the entire social protection system, you need to look at in creating, first of all, an inventory to know what social protection programs exist in a country. And then as a second step, analyze the performance of ideally each individual program, but then also what does this translate at system level into the performance of the system as a whole. And this performance is measured against, on the one hand, national social protection objectives. So CODI looks at what are existing commitments, laws, development plans at country level, and what targets do they set, or what commitments or objectives do they set for social protection, and how does the system perform in relation to the national objectives. But then it also looks at the performance of the system in relation to internationally set standards and to the criteria that the group of agencies has agreed on. So CODI contains a set of criteria. I'm going to introduce them on the future slides that were really carefully drafted and that took a long time to develop and to agree upon across the agencies, but there is now a set of criteria included in the tool that we are suggesting to measure the performance of social protection systems. Thirdly, the objective is to, through this analysis, create an evidence base that would then be used to trigger country dialogue and inform policies and social protection reforms. If we go to the next slide, please. So what's the theory of change behind that tool? So if you look at this slide, it shows the entire process of evidence-based policy formulation, if you want. And the CODI tool allows you to go through the first two green circles of the diagnostic and the assessment to then feed into the first blue cycle, the formulation of policy options. So at the heart of CODI are really the first two steps. And then we have another tool, the Social Protection Policy Options tool, that will facilitate the later two parts of formulating, once you have formulated certain policy options, assessing these policy options by trying to analyze what the potential impact they could have, the costs that would be involved in these options, and thereby, the global objective would then be to feed into improved social protection systems and improving the performance of social protection systems, and thus working towards improved coverage and improved benefits for the population. So, what is the key advantage of these ISPA tools, and how are they different from other existing tools that are out there? I think I've already mentioned they are interagency, and this is a great advantage for country level work because they represent already a consensus across agencies. They are agency neutral, which makes it easier for all agencies to buy in and agree to using them. And secondly, also what I already mentioned, it's the key organizations, development partners, UN agencies, but also academics. So it's really the leading experts working on social protection that provide their inputs and review these tools. So they're really cutting edge and a lot of detail. It's using this analytical framework, you can be sure that you have a sound framework that really covers all the essential aspects that you need to address when doing your analysis. But apart from this technical soundness, another key added value of ISPA tools are their emphasis on the process. Along with the tools come guidelines that try to suggest a good methodology for carrying out this analytical work at country level. And the guidelines emphasize the importance of a participatory process that really analyzes who are the key national stakeholders that you need to get on board. The importance of working cross-sector, which obviously for the social protection policies often is, and a lot of countries are struggling with the fragmentation across various sectors and ministries and how to bring them together. And so that to have on the one hand the technical soundness and on the other hand a suggestion of a process that could make it more likely that that the results really will feed into action and into improved policy making. And as part of this, these tools also contain a matrix to present an overview of findings along the agreed criteria. And so it allows to measure performance on a 4-point scale. And again, this was an agreement across the agencies that the tools should try and come up with such a matrix that gives an overview of the findings of the analysis. Of course, these guidelines are just guidelines, and in a lot of countries we see that the process was adapted and not all countries are using the 4-point scale. Some just produce a narrative report. But we're going to hear about this and the dynamics at country level in the 3 countries that we're going to cover. Next slide, please. So in terms of the analytical framework that CODI presents, as I said before, as a system tool, it has 3 levels of analysis. It looks in the policy module really at the system level, analyzing the legal and policy frameworks, the overall situation in the country regarding poverty and the needs of the population. It also looks at key aspects of the policy-making process in the country and the institutional capacity, as well as obviously at the global level, the government budget and public budget expenditure and financing. And also, as I said, national objectives that are being set for in the area of social protection. In terms of program design, it looks at how a program set up, how are the eligibility criteria defined, the benefit level and periodicity of payments and level of benefits, etc. And again, also at program level, obviously expenditures and financing are a key aspect, as well as the incentives that are designed around access to benefits. And then finally, on the implementation side, it really, so it does not just look at how does a program look like on paper, but also how does it work out on the ground? How is it actually being implemented? How is identification verified? And how are eligibility criteria verified? How do people register and how are they enrolled? What is the monitoring and evaluation process? What is the complaint and appeal mechanism? How is the general public informed and being made aware of the project, etc. So these are the key areas that were identified as the aspects to look at when looking at system performance. And these key areas are then assessed against 10 criteria that we're going to see on the next slide. So this is the list of the performance criteria that were agreed upon. The first 3 you can think of as the 3 standard dimensions that you look at when talking about any social protection program. Inclusiveness means the coverage of the population. Adequacy refers to the level of the benefits. And appropriateness means what situations or risks are covered. So it's kind of who gets what in which situation. And these, I think, are standard indicators. I mean, the first one, obviously, countries are also required to report on in the context of SDG 1.3. Together with a third one, because the data on coverage needs to be disaggregated according to children, disability, maternity, working age, elderly, etc. So you have the different contingencies covered there. SDGs don't require to report on adequacy of benefit levels, but this is clearly a key factor when assessing performance of a system. Whether the level of benefits is adequate enough to really make a difference to the recipients. And then the other criteria are also, I mean, quite obvious, standard criteria for measuring performance, respect for rights and dignity. So, I mean, do they comply with international standards and human rights standards, such as non-discrimination, data confidentiality, etc. Then, I mean, governance and institutional capacity. I think also quite self-explanatory in terms of why this is important to look at when assessing performance of social protection systems and programs. Financial and fiscal sustainability, coherence and integration and responsiveness. This actually there's 7 is coherence and integration. As I said before, fragmentation is often a great challenge for countries when designing their social protection system. So this looks both internally towards coherence between different social protection programs, but also external coherence. So the extent to which the social policies are coherent with other related policy areas, such as labor and economic policies, etc. And then the 8th criteria should be responsiveness. And this means, on the one hand, flexibility to react to emergencies or crises or natural disasters, but it also means responsiveness to longer term trends, such as demographic change or longer term need for structural transformation in the economy, etc. And then criteria 9, cost effectiveness, and criteria 10, incentive compatibility. These are actually quite demanding in terms of information and data that need to be available. So these are kind of, some include them in the analysis, some don't. They are more like optional criteria. If the data that is available, it's interesting to look at them, but it may not always be feasible to include them in a CODI analysis. Since the intention for CODI is not to collect primary new quantitative data. The only data collection that takes place normally in the scope of a CODI application is key informant interviews or qualitative data. But in terms of quantitative data, CODI just looks at the at what is readily available at country level. And I mean, identifying data gaps is also a finding, but the idea for CODI is not to generate new primary data. So I think this was what I wanted to say in terms of introducing you to the CODI tool, and then we can move into hearing from the country experience now.
Thank you so much, Veronica, for the brief introduction into CODI. Oh, we have a...
Sorry, yeah, there's one more slide on just showing a quick overview of where CODI has been applied so far. And
we can move to the next slide. Again, thanks, Veronica, for the brief introduction. And now we'll move to the country experiences. I'll guide the discussion with a few questions and then go around to each of the panelists to hear about their different experiences. We can go to the next slide. The first question is fairly straightforward. Why was CODI used and how was it adapted to fit the country context? Francesca, can we hear about Lebanon first?
Sure. Hi. So on Lebanon, the context, the background that led to the use of the CODI to map, well, part of the social protection system is a context of comparatively low provision of social assistance to Lebanese, to vulnerable Lebanese, and indeed also social insurance coverage, low social insurance coverage to Lebanese workers in comparative terms with countries in the region and beyond, in a context of economic downturn and of course of a comparatively large shock with the Syria crisis leading to a high number of Syrians displaced Syrians moving into Lebanon. So we're talking about over 1.5 million Syrian refugees moving into Lebanon, a country of between 4 and 5 million people. So in this context, there was growing concern for particularly for vulnerable Lebanese, and to what extent the social protection system or collection of social protection policies was adequately providing support, in particular to vulnerable Lebanese. In this context, UNICEF and the Ministry of Social Affairs, Lebanese Ministry of Social Affairs, decided to commission a study that would aim to map, in particular, the social assistance, so non-contributory component of social protection in Lebanon, precisely, as I say, because of a concern in particular for vulnerable groups. So the rationale being we want to have a clear mapping and diagnostic and analysis of schemes or programs that in particular have a direct and explicit objective to providing support or anyway, reaching vulnerable groups. And this is how this study came about. And the idea was that this mapping and analysis would then feed into a wider national discussion taking place on the strengthening of the social protection system as a whole. So as I say, this was UNICEF and Ministry of Social Affairs backed, sort of initiated process, and it contained within it a requirement to use the CODI, which is, I think, again, was fantastic, great to have that request. At the same time, of course, the scope of the work was for it to have a focus on social assistance. So, in fact, only an element of the full social protection system, and we'll come back to that in a minute. But just around adaptation, very briefly, yes, we did adjust and have to adapt the CODI, of course, and in particular for two reasons. One was to adapt it to the reality of the country, and I'll talk more to that in a minute. But in essence, we're talking about a country that has a number of characteristics when it comes to social protection and social policy more widely. One is a very high reliance on civil society and the private sector for the provision of social protection, and mostly, I would say, in kind or services provided as opposed to cash. In fact, there's no cash paid to vulnerable Lebanese. And the second was a need to adapt the CODI and the way we wrote up the report to take into account the precise requests that we received in terms of structure and questions that we needed to answer, that were mostly covered by the CODI, but did require some adjustment to ensure we were answering the questions we were being asked from the Ministry of Social Affairs.
Thank you so much, Francesca. Jorge, you're online. I mean, on display. How about the experience in the Philippines? Could you elaborate a bit more?
Yes, so in the Philippines, it was a bit different because that CODI was piloted in Philippines, and in 2014, if I understand correctly, there was a large mission, interagency mission going to Philippines to pilot this CODI tool. So back then there were many things happening in Philippines because the super typhoon Haiyan had just impacted. There was one of the largest typhoons in history, and social protection was really hotly discussed at that time. In addition, the NEDA, which is the National Economic Development Authority, which is the planning and coordinating body in the Philippines, was trying to revise, to update the social protection framework. So they had already developed a social protection framework in 2007, and they had updated it in 2012. So the government was looking for a tool to guide them on how to review the framework and then develop an action plan. So they were looking at CODI in a way to help them going through that process, and then to do the further reviews after every 5 years, if I remember correctly. So that was the context in the Philippines. The plan was to really deploy the whole CODI application. That means looking at social assistance, labor market programs and policies, and social insurance. And then also looking at all the policy, program design, and the program implementation. At the end, the inventory ended up with 60 programs, over 60 programs, social protection programs, and only 6 were chosen. So I guess we can talk later about how this happened, but that is the context in the Philippines.
Thank you so much. And can we hear from Ana about why was CODI used in Guatemala, and if you can elaborate on that?
This is the first time that Guatemala is using CODI, even though some people in the government already knew about it. We interviewed some personnel from the Ministry of Social Development, and they already had knowledge of CODI before. We don't know what institution or what agency came, to socialize this CODI before. CODI was used, first of all, because a request of the Minister of Social Development to UNDP to assess the social programs offered in the country. So UNDP here thought it was a good idea to use CODI for the first time. And we started in November last year to 2018. And it's, of course, has been adapted to the country reality. I think one of the things that we should study is first, one of the things I wouldn't do again is to start this exercise at the end of a fiscal year and beginning of the new one, because all the human resources in the government are closing year and opening the new one, budgets, programs, everything. So that takes a lot of their time. We interviewed 28 personnel, people from different institutions. We socialized the instrument, but we think using in the instrument for the first time and making the diagnosis of the country shouldn't be two exercises, different exercises. It cannot be combined because most of the attention is put on socializing the instrument and at the same time recollecting the data. The tool was adapted obviously to the country circumstances. This year, in fact, next Sunday, we have presidential elections. So we will have 5 months transition, political transition, and the next government is taken over on January next year. So I think also this is a good moment to use CODI and to have these social programs offer. So yes, we adapted the instrument, especially Module 1 for the national policy. In fact, we found that Guatemala, of course, doesn't have any social protection system formally per se, or social protection policy. So we had to adapt the instrument to have a map of all the components that we could call social protection. I would call it non-system, but we have a series of components. So we had to adapt it and use it as a framework to gather all data related to programs, strategies, policies, legal frameworks, in order to see it as a whole. And it came out okay. I think it's a very useful tool. And one of the reasons that we started to use it is because we want to make a standard procedure with the government to measures in the future. This time, this first approach is only presenting an offer of what we have in the country, and as a start point to develop later on a system, a concept that we don't have, still a concept, Guatemalan concept of social protection, starting to appear in some of the documents that the planning secretary is offering. And so I think it's a good moment right now, politically speaking, and also to show the need that we have to have a social protection, formally speaking, system, policy, and group together to have impact in the local level.
Thank you, Ana. We can move on to the next slide, please. The next question is, who were the key stakeholders and what was the composition of the assessment team? What was the process behind identifying the team? Let's switch it up and start with Jorge first.
In terms of the assessment team, as I mentioned earlier, it was an interagency team. It was composed of World Bank representative, ILO, GIZ, and the European Commission. In addition, they also, when they visited Manila, they discussed and had meetings with the WFP and other local NGOs. So it was really an interagency assessment, or at least this was the pilot, right, in 2014. In terms of the government stakeholders, the main one was the Department of Social Welfare and Development, and the National Economic and Development Authority, which is the planning and coordinating body in the Philippines. This mission also met the Department of Labor and other the social security system and Department of Budget and Management, for example. So yes, the first then eventually the mission had to orient the government onto what CODI is and what's the purpose of CODI. And that's when they identify the focal points, which I think these are key to eventually develop and fill up the questionnaires and conduct the assessments, right? So that's in a nutshell what happened in Philippines.
Francesca, can you tell us a little bit about the experience in Lebanon? Was it any similar or different?
Quite different, yeah, quite different. So in Lebanon, as I say, the entire process was primarily triggered by UNICEF and jointly with the Ministry of Social Affairs and I believe other international partners, but essentially was primarily driven by them. In practice, the implementation and request to implement the CODI in particular came from them. And the composition of the team was very different from what we've heard about the Philippines. So in particular, the implementation was carried out by a team of 2 social policy analysts or experts from the Overseas Development Institute. So that's myself and Rebecca Holmes, together with our colleague Rana Jawad, who's a senior lecturer at the University of Bath, and a professor at the Lebanese University, another sort of professor in social policy and health, Eli Mikhail. So the core team that was responsible for planning, sort of designing and implementing and writing up the CODI and the final study that emerged was in some ways quite independent, let's say, from any national or international development organization. At the same time, and we'll get to process in a minute, but of course, in terms of methods at all stages, whether at the design stage, at the information collection stage, and then later at especially at the review process stage, of course, it was all done in very close consultation with national stakeholders and international development partners.
Thank you so much, Francesca. Anna, you had mentioned a little bit about the beginning of this process, but can you elaborate on what was the composition of the team and the process?
There are 2 answers. One answer is the stakeholders. And I think in the stakeholders, we would mention 4 groups. One is 3 key institutions in the government, which are the Ministry of Social Development, the Planning Secretary, and the Minister of Finance. These 3 institutions were key for the study to provide information, policies, priorities, and etc. Then we have a second group, which are obviously, we have social information system, and this system provides information of 15 institutions that are implementing social programs. So we took those institutions as potential stakeholders in the program, and we did interviews of all these institutions. So this is a second group. And the third group will be obviously the UN agencies involved in the social protection group, which is UNICEF, FAO, Food Program, and Migration International Organization. These were key stakeholders because they had technical assistance to the team group. Now, the team group was, I'm the leading consultant, but we had an international consultant she's Yadira Diaz, She has a lot of experience in social programs, and she's from Colombia. She supported the group with the international concept and experiences. And then in the local team, we had a consultant specialized in productive sector, another one in finance and budgetary management, and the third one in social programs, especially cash transfers. So this is the national group and the key stakeholders. And of course, one group of the stakeholders, very important, were communities that we visited. We visited 10 communities in all of 3 priority programs that we selected. So we visit these rural communities. Some are indigenous, some are not, but the participation of these communities and the local authorities were key in the process.
Thank you so much, Ana. Can we move to the next slide, please? So this is about the process more in depth. Can you tell us a little bit about what went into the preparation or the desk review? How was the approach to the overall methodology, the selection of programs, and the data collection process? This time, let's switch it up again and start with Ana.
Okay, what we did was divided the process in 6 frameworks. The first one, obviously, is the general concept of social protection, nationally and international. We had a historic background of the country, and there we found something very interesting. We made a table of laws related to the social protection, and we found that the first group of laws comes from 1944 to 1947. And then there is a huge lack of laws related to social protection or development from 47 to 85, which really reflect the 30 years of internal conflict in the country. So this is very obvious, and from 85 that we had a new constitution, it jumps to 1996 where the peace agreement was signed. So that lack of social frameworks during that period reflects really the internal conflict impact in the social area. From 96 to date, there are many laws created in the social area, but all dispersed and with different concepts. But there is a good group of laws. This is why the historic background was very important. The legal framework, of course, that is what I'm talking about. Programmatical framework, we found these 81 programs and 115 benefits in the social system information. And then we have finally a functional outline, because we found that all the concepts in the laws and in the legal frameworks and strategies and planning is good. It's a good level. But when it comes to functional level, it doesn't work. So we'll talk about that later. But in these 6 big groups, we finally did a chapter on conclusions and recommendations, grouped in 5 different sectors like institutions, information system, monitoring and evaluation, budget and finance, and finally the selected programs. So actually these 6 frameworks came down to a table of recommendations grouped in 5 different sectors.
Thank you, Ana. Francesca, what was your experience with the process?
So on process and methods, just in general to say that it was very consultative. So it was done in close collaboration with, in particular, yes, the Ministry of Social Affairs, but also with, of course, colleagues at UNICEF and in consultation with other international donors. So that means that, or international agencies more generally. So that meant that in considering at the design stage even who we would consult with, because essentially we're talking about a review of existing information and consultation with key informants. So as Veronica outlined at the outset, we did not carry out any original analysis of microdata or new primary or collection of primary data. We're talking mostly a review of any available documentation, including ideally sort of non-published material, and consultation with key informants. Overall, the process and indeed the report is structured. There's a background review process around essentially creating a poverty profile. We're looking at poverty and inequality in the country, looking, yes, at monetary measures, but also beyond that. In particular, I just wanted to mention that there was in particular interest in the question of women and children, so differentiating by age and sex as possible. Then a historical overview, historical institutional overview of social protection more widely in the country, and so including the spectrum of contributory or social insurance type social protection and social assistance, but also importantly health and education. So we branched out into that as well. And a section on the question of humanitarian and social assistance linkages. We then narrowed down the focus on 3 specific programs that constitute the bulk of the work of the Ministry of Social Affairs, and that is social services and support to people with disabilities, social care for children, which makes up the up to 65–70% of spending of the Ministry of Social Affairs in Lebanon. And then the third specific program we look at is the National Poverty Targeting Program, which I'll come back to in a minute. From all of that, then, and I have to say that the CODI was critical in all of this at different levels. In terms of its utilization for bringing stakeholders together, national and international, but also framing the questions, including the way methodologically the study was set up and its focus, and in guiding then, of course, the analysis and assessment, which we'll get to in a minute. But in terms of methods, as I said, we relied primarily on a review of existing material to cover the range of questions that I mentioned, and to essentially populate the CODI. Now, as I say, and we might come back to this later, we had to adjust the CODI for a number of reasons. I mean, one thing that came up was immediately evident is that in some of the modules, module 2, 3, but this is reflected also in the assessment criteria, the way they're currently written up. There is a strong emphasis on cash or cash benefits, frankly. And I say this as someone who worked on the elaboration of the CODI. I was part of the working group. So for a country that does not have cash benefits, it is still absolutely valuable, the CODI, the framework, and all the way to the assessment criteria. However, we did have to adjust them a bit or reframe them somewhat to be able to apply it to a context where we were actually mostly talking about services. Just to come back to your question, selection of programs, again, yes, we did end up focusing on 3 large national programs that constitute the bulk of social assistance in Lebanon, and this was a combination, the result of, again, where the demand was coming from, where the interests were in terms of mapping, but it also leaves a gap. So clearly what this study was able to produce, although it produces a mapping and an initial sort of reflection on the wider set of existing programs, the fact that the full implementation is on the social assistance provided by Ministry of Social Affairs, meaning that yes, the rest of the system still needs to be mapped, ideally using the CODI. Sorry, can I just add one more quick thing, just because yes. Thinking back to what Anna was saying also, that in terms of key informant interviews as well, in this case, again, given also the scope and resources available, what we did do was everything was done in consultation with stakeholders primarily, frankly, in Beirut, in the capital. But we did talk with people from all sorts of ministries, Ministry of Health, Ministry of Work, Ministry of Finance. We talked with the We held key informant interviews with the National Social Security funds, some of the mutual funds, so also to cover and bring in aspects of social insurance as much as possible. We also spoke with, importantly, with social workers. So when it comes to social assistance, again, we weren't just talking with public officials at the national or federal level, but also with social workers directly responsible for management and implementation on the ground, which was critical to raising some of the issues that we then report, came up in the report.
Thank you. And last but not least, Jorge, what was your experience?
Yes, but it's. I think Francesca said it very well. It was a very similar process here. Consultations were key, and the desk review as well. So I just, not to repeat the same, I just want to highlight a couple of things that came to my mind now. On the desk review, it's critical. You don't want to just go there and have meetings and you don't know the basics, right, about the programs that they implementing. So we had the team had to review all sorts of literature, the reports, impact assessments, and try to already populate the questionnaire ahead to identify what information is missing, right? And the other thing with the literature review or the reports that you can review is that most of the time the information is outdated. So part of the job is to update the information, to look for these new numbers, right? So that's one point on the desk review. And in terms of the consultations with the government and stakeholders, yes, it's right that it's very important to meet the management level, but always also to meet the technical staff. I mean, because at the end of the day, they will really also need to provide you with this the specifics, the details that we're looking for, no, for the CODI tool. So it was very important to get the buy-in from the high-level management and also the technical staff. That was key. And yes, the CODI provides you a questionnaire. Well, it's 3 main questionnaires, and with more than 200 questions. And it is really part of the job of the person applying the tool to kind of rephrase sometimes, make them easy to understand. We cannot just give the questionnaire to our counterparts, no, and expect them to understand all these complex terminologies. So we really need to do a good job of streamlining the surveys and having really a consultation type of work, not necessarily just filling up the questionnaire. So so that's and how do they select the programs? I believe this was agreed between the team, the mission team conducting the CODI and the high-level management in terms of which were the biggest or largest programs in the Philippines. And so there were 2 social assistance programs, 2 active labor market programs, and 1 social insurance, and 1 community-driven development program, which was also assessed. So in total, there were 6.
Thank you so much. Let's do a time check. We have half hour left, so the next question we can be a bit more brief. And it's also related to many interesting questions that are coming through. The question is, how did the team use the data and information collected? And the related questions is how to deal with data collection where there isn't many data available. Let's start with Francesca. Did you have any experience? What was your experience in data collection?
So of course our starting point in many ways was the CODI, right? Of course we adjusted this. This was at the very beginning of even in approaching this work was to try. I mean, as Jorge very clearly, and we did very similar things. So we tried to populate it with any available information we had by sitting at our desks wherever we are. In my case, sitting in London. So. And with the support of course, already of certainly UNICEF, but also colleagues at the World Bank, at ESQA, and elsewhere at ILO that were submitting. So we did an initial review of available documents to populate as far as we could the adjusted CODI. We then did. Again, as I say, we didn't do any primary data collection. What we did was additional searches, particularly as we started to pick up the consultation and working very closely, in particular with the Ministry of Social Affairs that we were really looking at in great detail. and in consultation, conversations with public officials at different levels and in charge of different aspects of policy, ranging from issues of, as we said, legislation and policy design and regulation, to the details of policy design, to any information on actual implementation and sort of monitoring related information, all the way to actual evidence of impact. We were, reaching out to, as I say, public officials, but also particularly around issues of, when it came particularly around evidence on impact, looking at also reaching out to academic experts across the country. All of this in an attempt to try and, as I say, populate as much as possible. And I have to say it's tremendously useful, the CODI, because if on the one hand, I mean, it can get extremely detailed and it is challenging to fill in everything it asks for, and indeed, as a result of information limitations and constraints, the truth is there were many questions that remained unanswered. It is tremendously useful in guiding, in framing the approach and in guiding the investigation, right? Together with, as I say, this wide group of stakeholders, because you do everything you can to try and retrieve the information that will allow you to map all these different elements of, as we said, policy, ranging from the legislation and regulation all the way down to impact. As I say, it's a mixed process in the sense that, on the one hand, it means that you strive, and the team, everyone involved, did everything they could to map as much as possible and facilitate the analysis. On the other, you're well aware of the limitations, and this we'll come back to this, I'm sure, when we get to the assessment, which is, the assessment part, which is, yes, on some things we were able to certainly to flag, what works less well, certainly where the gaps. So in terms of monitoring and diagnostics, a lot could be done. In terms of actually drawing any conclusions on actual drawing from impacts, that became more of a challenge in many cases because of a shortage of evidence, which means that we could, discuss certain, raise certain questions, but on some we just did not have the answer.
Thank you. Anna, what was your experience in Guatemala?
Well, of course, we used all the CODI instruments, but specifically we used Module 1 for the public policy that was shared with the planning secretary team. And we had information from documents they are producing, because this is a very dynamic sector. Everything is changing all the time, and from the moment that we started this study up to date, things have changed in the social area. So this Module 1 was filled up with support of this national planning secretary and the team that they made to support us on this. Module 2 and 3, I forgot to mention in the last question about the 3 selected programs. We selected 2 programs of the non-contribution system and 1 of the contribution system, the social security system. So the 3 programs were had the Module 2 and Module 3 filled up with respective institutions that were in charge of those programs. We did cash transfers 1. The second one was the food program of the education system, and the third program that we used on the contribute system was the program that had the social security for sickness, maternity, and accidents. So the 3 will show you a wide aspect of the 3 programs that, the social protection, contribution, and non-contribution. All the data was analyzed by the authorities, and then as a team we had 3 internal workshops to revise all the information. Then we shared this information on periodic meetings with the UN agencies that were supporting the work, and finally with the institutions that own, for the say, the selected programs. So this is the way we assessed it. We made tables, inventories of all the documents. We have a very good library now of all the local and international documents that were used as reference. And as I said, this is changing very fast in the country due to the high levels of poverty and extreme poverty. Now, the selected programs that we used, we had some criteria developed by the team. One of them is that this program should cover at least 20% of the extreme poverty population. The second criteria that we used was the program had to have legal framework and operational framework, formal ones, because there are some programs that do not have any legal framework, just a small agreement within the institution, so that wouldn't work for us. And the third one was to have this program, let's say, alive for the last 2 years, because we found good experiences in the past, but the programs are not working right now or do not have huge coverage or massive coverage in the area. So these three criteria were very useful to find these three programs. And of course, the contribution system program that we selected is not covering the extreme poverty, because the contribution system is covering only people on the formal market, labor market, and so they have at least a minimum salary, and this population do not belong to the extreme poverty. So the other two do, and then there we selected some of the communities to visit that we will mention afterwards. But the communities were very important for us to validate all these cabinet information in field. If actually what all the manuals and systems and information available on websites is really reflected on the local level. And of course, we have some findings in the area that we will share later.
Thank you, Ana. Jorge, what was the experience in the Philippines?
Yeah, just very briefly. Basically, four things I would like to summarize in four bullet points, if ever. Number one is that yes, that the questionnaires are a guidance, are perfect guidance for you to apply the CODI tool. The second one is that if the programs you are going to study already have good reports, annual reports, then it's not going to be so difficult. The third one is that we would like to have, ideally, household budget data where you can then do the analysis of the coverage, adequacy, inclusiveness, everything. But usually that's not the case. Sometimes you will find household budget data only for some of these programs. But then you can complement with admin data and expenditure data, and that could also be useful to generate some of these performance indicators. There may be problems with double counting once you use admin data, but still, I think it's very useful for doing the assessment.
Thank you, Jorge. Next question, and we're also tight on time, so the most interesting questions will have to be brief. If you could share what were some of the key findings, challenges, and lessons from your experience. Let's switch it up. Jorge, you start.
Sure. In terms of the implementing the CODI, there are several lessons. I guess I would like to highlight only 3 or 4. One is that it is obvious that we need to get the commitment of the government to implement a tool like CODI. We cannot do it alone. We cannot just rely on reports. We need their feedback. That is number 1. We also need to build ownership. We need to work with them closely. We cannot just do this remotely. We really need the colleagues who are based perhaps in the country offices to be part of this process, so that they can really provide also added value to the whole CODI process. One more is that, and this is something that the team learned while doing the CODI pilot, is that we cannot just focus on the questionnaires. So as I said earlier, we cannot just give the questionnaires and expect our counterparts to fill them out. this has to be really a consultative effort, no? And there has to be several consultations, meetings, and back and forth. So we need to make, in that regard, we need to make the questions user-friendly, right? And perhaps one more lesson is that, and maybe it doesn't apply for the Philippines, but it does apply for other countries, that doing this inventory of the social protection programs in any country is already a big plus. There are many countries where you won't find this information in one document. So I think, and maybe this we can discuss later, but this is already a big plus for any country, and an incentive for any country to implement CODI.
Thank you. Ana, how about the challenges and lessons from Guatemala?
Okay, I think we can have 4 of many that we have, but I selected 4 of them. First of all, is obviously the lack of social laws in this 30-year period, which was really a valuable information to understand how the situation is now. So we found a group of several generations of dispersed laws, strategies, planning, etc., that have to be grouped together in order to see a social protection system there. Of course, there is no social protection, formally speaking, system, but we have a group of these dispersed laws and other instruments that I think it easily could be harmonized and become a social protection system in the next years. We also found something interesting, that all the key information systems are do not communicate with each other. So all the information systems, key information system, as the social information system and the accounting and budget information system, do not communicate, and we had to do some things, by hand. Just taking the programs versus the expenses reflected on the different systems. And sometimes the programs are not called the same. So in the social information system, they have one name, and in the account and budgetary system, they have another name. So we had to put together all this information, and this is one of the key findings that is important for the government to know. And of course, the lack of information between the central and the local level. Here, they do not communicate policies or priorities or actions to the local level. So when you visit the local level, actually, the way they see the programs and they see the information is absolutely different from what they see at the central level. So this was very important for us, because they have to build these communications, and the local level has to have access to the information systems to see how their own programs are moving. I mean, the monitoring system of all these programs is very bad. And of course, we don't have an impact system to measure the impact of these programs in the country. This is very important. There was census last year after 12 years. So I think we will have initiation line based on that census for the future. And so we can really monitor the impact of the programs later on. But right now, we don't have anything about that. So this is, 4 of the most important key findings in the study. And the CODI, of course, as I said at the beginning, socializing CODI within the governmental institution has to be separate procedure from analyzing the social offer. I would say that first we have to socialize CODI and have some workshops with the key teams in the government, and then make together the study, because mixing 2 together, I don't think it's recommendable, in my opinion.
Thank you, Ana. Francesca, what were some of your challenges and key findings?
So in terms of process, CODI process, I think, well, Jorge and Ana, I mean, spot on. I think it's absolutely critical to get as many institutions and partners involved and at a minimum sort of interested and keen to contribute to the process. That's crucial to enabling the process and the implementation of the CODI, but also for it to work, to reach its intended outcomes, not just in terms of the mapping, diagnostic, and assessment, and there is the report that results from that, which is good to have, but also in terms of the dynamics that we want to be generating as part of this process, which is improved and enhanced dialogue, conversations on these topics and dialogue across between social partners and across institutions, nationally and internationally on the topic. So that's absolutely critical. I think one of the lessons learned was that in the case of Lebanon, what was hugely useful, again, both in terms of implementing the CODI and achieving and reaching the completion of the study, but also from a perspective of stimulating dialogue and discussion, were the consultations along the way, but also the processes, the review processes. So as we collated the information and were writing up also the diagnostic and analysis, we did of course also present findings at different points in time and with different stakeholders, and I think that was also very useful, both in informing the study and in triggering and stimulating discussion. With regards to the study itself, the findings are grouped across in two sections. One we discussed broader findings that are sort of relevant more widely to the social protection. I struggle to call it a system, but yes, to social protection more widely in Lebanon, and we frame that around issues of concepts and defining social protection, the question of institutional mandates and coordination between different ministries and their responsibilities, social protection financing, importantly, of course, striking the balance between social assistance and social insurance, which relates to issues of financing, importantly, but not just that. Critically to Lebanon, the role of the private sector and of non-governmental organizations, and then the humanitarian and development nexus, which again is particularly important to Lebanon. But then a bulk of the findings are then specific to the three sets of programs, because they're not even individual programs, they're more sort of areas of work that the Ministry of Social Affairs in particular focuses on. One is on, as I say, disability, children in institutional care, so institutional care for children in institutions, and the National Poverty Program. And for these, we look at legislation in detail, legislation, policy design, policy implementation, coordination, fiscal financing and fiscal capacity, sustainability, and then measurement, M&E, and data. So all of this to say that this is how we frame the findings, and yes, there's lots to say about the concrete findings, which we don't go into right now. But the CODI, as I say, was critical to enabling and facilitating all of this. Just a quick word of warning. I mean, I think hopefully that the sort of the length of the CODI, the detail of its questions, should not put people off or institutions off from using it, right? So let's use it and let's be faithful to the tool, but at the same time, think about some degree of flexibility in using it. And definitely, yes, promote, of course, interagency collaboration. But that is partly a sort of a chicken and egg situation. I mean, ideally, you would have it at the outset, but it's also true that the implementation of the CODI, at least in the experience I've had so far, also triggers that. So I think we just sort of need to get it going, and then these things will momentum picks up.
Thank you so much. We're almost out of time, so to leave enough time to answer audience questions, let's move to the next slide, please. As briefly as possible, let's go around the group. And you've already mentioned a few of these issues. What was the dissemination process, and was there take up by government? Were there any results or impact? Jorge, let's start with you.
Sure. Yes, briefly. Yes, the CODI report was not published as a CODI report. At the end of the day, we felt that while we did try to do the assessment matrix using these 10 performance criteria and using the 4 point scale rating system. We did it, but we didn't have the opportunity to discuss this with the government and get their feedback. So at the end, we published this report, which is called the Philippine Social Protection Review and Assessment, but does not include the assessment matrix. So that is just to clarify that it is not really disseminated as a CODI report. However, we did use many of the indicators of the CODI performance indicators in this report, and we believe this has been useful. We have seen some citations in the media. We have seen that the government hopefully will use it for when they revise again their social protection framework. And well, we cannot attribute certain things to this report, but we have seen recently that the conditional cash transfer, one of the largest social assistance programs in Philippines, has been institutionalized, and they have a lot of experience implementing this program. So the provisions are very clear. The institutional arrangement is very clear. So they have really done a good job and follow what we call good practice. So I mean that's in a nutshell what has happened with this CODI report in Philippines.
Thank you, Francesca. How about for Lebanon?
So for Lebanon, I mean, so this study is really part of a recently initiated process to develop a national social protection framework. So I mean, we're very much hoping that this will feed into this process. I suspect it is, but we are still waiting to see exactly then in what ways some of the, I think particularly some of the questions raised by the report, some of the gaps flagged, you know, to what extent or how they will be addressed over time. I think certainly it is feeding into some of the dialogue that is taking part in the country, particularly with regards to the social assistance elements that we look at in detail. On dissemination, it currently has not been disseminated. We very much hope that it will be disseminated in some form. So we're still we've just had a final round of reviews with the ministry and other colleagues and experts that have reviewed it. So we need a sort of final sign-off, certainly from the Ministry of Social Affairs, that they would be in agreement. But we very much hope it will be made public in some form, whether it's a full form or in a shortened version. But I think certainly there are even also and again, not in the form. It's not a strictly speaking a CODI report. It's in almost a wider analysis, really. But I think it could be extremely useful for a range of people that are interested in social protection and social policy more widely, whether from a research perspective, sort of design perspective, or implementation, evaluation perspective. So yeah, I will keep you posted on when it will be available in some form.
Thank you, Ana. Could you tell us a little bit about the experience in Guatemala?
Okay, yes, I think I would suggest that in the future, since it's a new team, new government team will come in January, that some workshops should be held with the new personnel, the new people, to socialize CODI and try to have an homogeneous system to follow up on the social protection system. That's one thing. The other thing is that I think we should, well, first of all, this study is not finished yet. We still are on the final stage of closing the study, and then it will be presented to the UN representative agencies in the country next July. After that, we will go to the Ministry of Social Development and show the results and see, which parts could be published and which we have to work as confidential. On the other side, all the conclusions of this report and the support documentation will be available sometime in the UNDP website in Guatemala as CODI instrument. And so let's say that this is going to be like initial base of the social protection because it has all the components. But the next step, as I said, is work with the next government to define social protection in Guatemala, see what components are going to be included in the concept. We already are working on the multidimensional poverty indicator, and this is including some of the areas of social protection. So I think an exercise should be done with the next government using CODI information, which of course the document has, as Francesca said, a lot more than the CODI will give. It has some other policies and components that Guatemala has in the offer. So I think the results and the impact will be can be seen in the short-term future. And I think you know, the political parties right now, just a few of them have the social protection as a priority, and I think this is one of the goals of socializing CODI in this moment. I think it's important because one of the problems that we found in the social protection area is this is not one of the political priorities in the government. It has not been in this government and not in the last government. So I think this is key to introduce the study right now, and then socialize the need that Guatemala has to have a social protection system as a political priority.
Thank you. And let's move to the last question, which I will make a yes, no answer question. So did you find the assessment matrix useful? Let's go around. Francesca, you were nodding.
The answer is yes. It's a big yes, hugely useful. And just to be clear, I mean, the assessment matrix does a number of things, but at a minimum, and it's already a lot, it sets out some very clear criteria and defines them, and that's already hugely useful. I mean, I can't stress how important that is. And we use it across, you know, every question we asked, everything we tried to map or analyze, we looked at, well, to be fair, we decided to only look at 9 out of 10 dimensions. We dropped cost effectiveness because it was just, yeah, I mean, I'm smiling just because even just trying to define it, and it was just, we just could not sort of tackle that in the scope of the study. But every other one we considered, and of course had to adjust and adapt depending on the precise intervention or aspect we were looking at, but hugely important. Just to be clear, with Lebanon, we did not use the scoring, and there are various reasons for that, and I don't think that necessarily weakens you know, what we have accomplished, all of us, you know, as a team working on this, because it is still, you are still carrying out an assessment. You're not necessarily attributing a value to it. That doesn't mean we don't flag where there are, you know, points that, you know, issues that need to be looked at, the limitations, potential options moving forward, that, you know, things that need to be done. That's still all in there. A quick, I mean, I think just a minor point, but it did strike me a little looking back at the document, the overview of findings document, is that there is in brackets under some of the criteria that we should apply only if evidence exists. And in particular, this is there, I don't know if this is intentional, or I can't remember whether it's dropped off out of the document. It's only there in the case of cost effectiveness and incentive compatibility. But of course, throughout, and certainly in the case of Lebanon, but I'm sure this is true for most countries, you know, even the UK where I live in, or Italy where I come from, the truth is, you know, we have major, if we really were to try to complete the CODI, I mean, there will always be shortages in terms of information. We do our best with what we have. In some cases, that means we cannot score. I mean, we have to be very cautious, particularly where there are big gaps. That doesn't mean that it's not still tremendously useful to use this matrix.
Thank you so much. Jorge, you were also.
Yes, so the matrix assessment metric was super useful. We did try to score each indicator. It was very tough. It was very difficult. And I do agree with Francesca that whenever there is not enough evidence, it's better for us to just skip or simply make an assessment without a number.
And Anna, how about for you?
Very useful, yes. Also, we did it in 2 levels. One at the concept level that we applied the criteria, And the concept level, we will say that planning and concept framework is very adequate, it's inclusive, it's respectful of all of the human rights, pertinent, but when it comes to the functional level, the overview of findings will tell you that we have a latent level that is weak, that is not working, and it doesn't have any ways to communicate to the people. The way they focus beneficiaries is not clear. So I think you can see it in two different levels in the country, but very useful, first of all, to separate these two levels, and then to see that actually we don't need to work as much in the planning or diagnose the country, but in the functional level. So it was very useful for us to find that.
Thank you so much. My timekeeping wasn't great, but we'll extend the webinar by 10 minutes. So if you can stick around to hear some of the questions of the audience. We've been trying to bundle them up. So if Veronica, you can start with the ones related to CODI or the overall process.
Yes, I hope that's fine for the other presenters. So I will go through the generic questions, and then if you want to add on to what I'm saying on the generic questions, feel free to do so. And then Veronica will also ask the more specific country questions. Mm-hmm. So we had quite a few questions on the question of indicators and scoring and how to evaluate performance if there are no clear benchmarks or indicators. And so, I mean, the way the assessment matrix is designed is that it's a 4-point scale, and for each of the criteria, we have a detailed description of what counts as good performance. So, I mean, clearly there's still a kind of subjective element here, because we ask experts to then assign the score. But first of all, by working with the social protection experts in the country, and second of all, by providing guidance to what counts as good performance, we do think that this can actually still be a very meaningful way of assessing performance, especially in the absence of huge quantitative data that very often, I mean, we would like to see all kinds of household micro-level data and then aggregated data, or but that just in many countries we won't find. But there, I mean, there is a subjective element, but we still think the findings are very useful of that. Secondly, this question of, yes, we have reached interagency consensus on these tools, but how do we ensure government buy-in? I mean, first of all, because they are interagency tools, we think it's easier to present this to governments and for governments to also agree that, yes, this is something that they would like to apply. But also, more importantly, I mean, typically, of course, governments don't come to us and say, we want a CODI application, or we want another tool that is being applied. Governments come, I mean, when they submit requests to UN agencies, they say, we need advice on how to design our social protection system, how to draft a new social protection policy, or how to do a social protection sector review. And then very often it's the agencies that then suggests a suitable methodology. I mean, that's the more likely case. And we do think that CODI has something to bring for countries. And I mean, I've just been involved in Senegal, where the Senegalese government said, well, we've been carrying out these social protection sector reviews periodically, and each time we've worked with a different consultant, and we've had kind of a different methodology in the report. So it's very difficult for us to now actually see what has happened over time. So if you have this systematic framework and you apply it periodically, then it's better to trace progress or lack thereof over time. And so hopefully by disseminating the tools and making them more widely used across the UN system, but also other development partners and in country, ideally we would allow for this tracking progress over time. Having said that, another important aspect to keep in mind is that we're not looking for cross-country comparison. As we said, the tools in any case, they need to be adapted to each country question, the country context, and to the specific question and objectives that at each point in time the government is most interested to address. So that methodologically, it won't be possible to compare, but also it's not the objective. We want to really help at country level find better solutions for gaps or challenges that they have. Then another question that we had is about the availability of reports. Unfortunately, not all governments agree to publish the reports and make them available. Most of them so far actually unfortunately have been confidential, but the reports that are published are available on the ISPA Tools website, and you can look by, if you search by, there's one site for each of the different ISPA tools. So if you go under CODI, reports that are being published should be listed there, but for the time being we haven't any published reports on there, just because we don't have any that aren't confidential and already published. But there's several in the pipeline, and we hope that there will be some available publicly soon, including the ones in Africa. We had another question on what have been CODI applications in Africa. So we've been using the tool in several African countries, including, for example, Zimbabwe, Central African Republic, the Gambia. Currently, I mean, some are concluded, some are ongoing, so there's still an application ongoing also in Nigeria. And listing these countries, it also becomes apparent that even in countries with very limited data availability, you can still have a very interesting report resulting from the analysis. And Francesca said, don't be put off by the huge data collection framework. We don't say questionnaire anymore, because that's another concern, what Jorge said. It's a framework for the data collection. It's not a questionnaire that you can take and apply and just go with two partners. It's a framework, and you need to take the elements that are relevant for you for each key informant that you go to, and prepare a questionnaire out of this huge collection of possible questions. And so, I mean, if you're scared off by the data collection framework, which contains many questions, only if you just look at the 18 key areas that I presented and the 10 criteria and the assessment matrix, I think you can do an excellent analysis just taking those elements. The longer list of questions that we provide in the data collection framework, it's more a checklist for you to double check that you haven't forgotten anything. And if you are able to answer 30 or 40% of the questions that are there, I think it's already great. I mean, it goes without saying that a lot of the information won't be available, but those that aren't available, you can find ways to try and find information in a different way. For example, through the key informant interviews. But I've talked too much already, because I think we only really have 3 minutes left. And so, Anna, please ask maybe the country-specific questions to Francesca, Jorge, and Anna.
Okay, so let's start with Guatemala. We have a question. Anna, you had mentioned that there's changes in government. Are there plans to continue the implementation of the findings of CODI? And also, a second question is, the Guatemala was an interagency application. Oh, sorry, it's the same question. How are you planning to use the findings with the new government? And the second question is, what were the prioritized selected programs for Guatemala?
What were the prioritized programs? That's the question?
Yes, one question, and the other one is the plans for using the findings with the new government.
Okay, well, the plans for the new government, I think the UN system agencies are planning to support the political transition that is going to occur between August and January this year, after the second electoral round, which is in August 18. So I think they are planning a transition, and one of the key components of the transition will be the social protection. But that's not for me to say because I'm just a consultant. I don't know what plans UNDP has for this document in the short-term future. And the second one is the 3 programs that we chose to be priorities is the cash transfers focused on the education bonus. The second one is the the education ministry program for food programs in the schools. This is not a new program, but a second phase of a program that provides food to all the 28,000 out of 35,000 schools in the country. They provide a very innovative element for this year, that is that 50% and going to the 70% in the next 2 years, they can buy the food inputs to the local production sector. So this is becoming one important element because it is going to raise the level of the small productive groups in the area, especially women. And we think that this chain, as is going to function, will put in together the organizations of the parents in the schools with the production groups in the rural area, and they can buy the food from them, or at least some inputs that they need to provide the food for the kids. So these 2 programs were very important. And then the third one is the contributive system program, as I mentioned, which involves 3 big sectors, which is sickness, maternity, and accidents. It's one huge program that the social security system has in Guatemala. These are the 3 programs that we selected.
Thank you, Ana. I believe we have run out of time. Do you have time for one more question? Okay, let's see. There's a clarification question for Lebanon and Philippines. So for the Philippines, it seems like it was a system assessment, and with Lebanon, it seems like it was focused with one agency only. Is that correct? Francesca, do you have a clarification, an answer to the question?
Well, so no, as I mentioned, so the study does an initial mapping that is fairly broad, but yes, the primary, and as I say, the consultation was carried out with a range of different ministries, and not just ministries, but as I say, also other for instance, organizations involved in social insurance provision and other policy provisions. But yes, it's right to say that the primary focus is the Ministry of Social Affairs, and that they were our primary counterpart together with UNICEF in this work, which means that yes, what we still need to do a lot more on is the detailed mapping and diagnostic and assessment of other, in particular the contributory side of things. So ideally there would be an extension of this work, or someone would take on this additional mapping and analysis, bringing in the ministries that, as I say, were consulted, but could be additionally brought into this effort.
Thank you. Unfortunately, we have run out of time, so we'll try to get to the remaining questions offline. Thank you so much to all of our panelists and everyone that attended, and a special thanks to socialprotection.org. Remember, you can find the recording on the socialprotection.org platform and also on the ISPA website. Thank you again, and hopefully we'll get to do future webinars.
Thank you.
Thank you. Bye.
Bye.
Goodbye, and thanks for listening.
Thank you. ¿Y ahora cómo nos vamos de aquí?